Anxiety disorders affect millions of people worldwide, significantly impacting their quality of life and daily functioning. As researchers and healthcare professionals continue to explore effective treatment options, one medication has gained considerable attention for its potential in alleviating anxiety symptoms: fluoxetine. This video delves into the multifaceted nature of fluoxetine, examining its mechanisms, applications, and potential benefits in managing anxiety disorders. Fluoxetine, widely recognized by its brand name Prozac, belongs to a class of antidepressants known as selective serotonin reuptake inhibitors, SSRIs. While initially approved for treating depression, its therapeutic potential has expanded to include various anxiety disorders. As we explore the intricacies of fluoxetine's action on the brain and its clinical applications, we aim to provide a comprehensive understanding of how this medication may offer relief to those struggling with anxiety. Understanding fluoxetine's mechanism of action. Fluoxetine's primary mode of action involves modulating serotonin levels in the brain. Serotonin, a neurotransmitter associated with mood regulation and emotional well-being, plays a crucial role in anxiety disorders. By inhibiting serotonin reuptake, fluoxetine increases the availability of this neurotransmitter in the synaptic cleft, potentially alleviating anxiety symptoms. Serotonin regulation and anxiety research has shown that individuals with anxiety disorders often exhibit imbalances in serotonin signaling. Fluoxetine's ability to enhance serotonergic transmission may help restore this balance, leading to improved mood and reduced anxiety. The medication's selective nature allows it to target serotonin specifically, minimizing effects on other neurotransmitter systems. Neuroplasticity and long-term effects. Beyond its immediate impact on serotonin levels, fluoxetine has been found to promote neuroplasticity, the brain's ability to form new neural connections. This property may contribute to the medication's long-term efficacy in managing anxiety disorders. By fostering adaptive changes in brain structure and function, fluoxetine could potentially address the underlying neurobiological factors contributing to anxiety. Interaction with other neurotransmitter systems. While primarily affecting serotonin, fluoxetine also interacts with other neurotransmitter systems to a lesser extent. These interactions may contribute to its overall therapeutic effect and could explain its efficacy in treating a range of anxiety disorders. Understanding these complex interactions is crucial for optimizing treatment strategies and predicting potential side effects. Fluoxetine in the treatment of generalized anxiety disorder. Generalized anxiety disorder, GAD, is characterized by persistent and excessive worry about various aspects of life. Fluoxetine has shown promise in managing GAD symptoms, offering relief to many individuals struggling with this condition. Efficacy in reducing worry and tension. Clinical studies have demonstrated fluoxetine's ability to significantly reduce the intensity and frequency of worry in GAD patients. By modulating serotonin levels, the medication helps alleviate the constant sense of apprehension and tension that often plagues individuals with this disorder. Impact on physical symptoms. GAD often manifests with physical symptoms such as muscle tension, fatigue, and sleep disturbances. Fluoxetine has been found to address these somatic manifestations of anxiety, providing comprehensive relief to patients. This dual action on both psychological and physical symptoms makes fluoxetine a valuable treatment option for GAD. Long-term management and relapse prevention. One of the challenges in treating GAD is maintaining long-term symptom relief and preventing relapse. Fluoxetine's sustained action and ability to promote neuroplasticity may contribute to its effectiveness in long-term GAD management. Continued research is exploring optimal treatment durations and strategies for maximizing fluoxetine's benefits in this context. Fluoxetine's role in panic disorder treatment. Panic disorder, characterized by recurrent, unexpected panic attacks, can be debilitating for those affected. Fluoxetine has emerged as a promising treatment option for this condition, offering hope to individuals seeking relief from the intense fear and physical symptoms associated with panic attacks. Reducing panic attack frequency and intensity. Clinical trials have shown that fluoxetine can significantly decrease the frequency and severity of panic attacks in individuals with panic disorder. By modulating serotonin levels, the medication helps stabilize the brain's fear response, potentially preventing the onset of panic attacks or reducing their intensity when they do occur. Addressing anticipatory anxiety. Many individuals with panic disorder experience intense anticipatory anxiety between attacks, fearing when the next one might occur. Fluoxetine's anxiolytic effects may help alleviate this constant state of apprehension, improving overall quality of life for panic disorder patients. Combination with cognitive behavioral therapy. While effective on its own, fluoxetine's benefits in panic disorder treatment can be enhanced when combined with cognitive behavioral therapy, CBT. This integrated approach addresses both the neurochemical imbalances and the thought patterns contributing to panic attacks, potentially leading to more comprehensive and lasting relief. Fluoxetine in social anxiety disorder. Social anxiety disorder, SAD, is characterized by intense fear and avoidance of social situations. Fluoxetine has shown efficacy in treating SAD, helping individuals overcome their social fears and improve their ability to engage in social interactions. Reducing social inhibition and fear. By modulating serotonin levels, fluoxetine can help decrease the excessive fear and self-consciousness that individuals with SAD experience in social situations. This reduction in anxiety may enable patients to participate more fully in social activities and improve their overall social functioning. Enhancing social confidence. As fluoxetine alleviates anxiety symptoms, many individuals with SAD report increased confidence in social settings. This boost in self-assurance can lead to positive social experiences, further reinforcing the benefits of treatment and potentially breaking the cycle of social avoidance. Long-term outcomes and quality of life. Research on the long-term use of fluoxetine for SAD has shown promising results in terms of sustained symptom relief and improved quality of life. The medication's ability to promote neuroplasticity may contribute to lasting changes in how individuals with SAD perceive and engage in social situations. Fluoxetine in the treatment of obsessive-compulsive disorder. Obsessive-compulsive disorder, OCD, is characterized by intrusive thoughts, obsessions, and repetitive behaviors, compulsions. Fluoxetine has been approved for OCD treatment, offering relief to individuals struggling with this often debilitating condition. Reducing obsessive thoughts. Fluoxetine's impact on serotonin signaling may help decrease the frequency and intensity of obsessive thoughts in OCD patients. By modulating brain circuits involved in repetitive thinking, the medication can provide significant relief from the mental distress associated with obsessions. Alleviating compulsive behaviors. In addition to addressing obsessive thoughts, fluoxetine has shown efficacy in reducing compulsive behaviors in OCD patients. This dual action on both the cognitive and behavioral aspects of OCD makes fluoxetine a valuable treatment option for many individuals with this disorder. Dosing considerations for OCD. It's worth noting that effective doses of fluoxetine for OCD treatment may be higher than those typically used for depression or other anxiety disorders. Healthcare providers carefully titrate the medication to find the optimal balance between symptom relief and side effect management for each individual patient. Fluoxetine in post-traumatic stress disorder. Post-traumatic stress disorder, PTSD, is a complex condition that can develop following exposure to traumatic events. While not specifically approved for PTSD, fluoxetine has shown promise in managing some of the anxiety-related symptoms associated with this disorder. Addressing hyperarousal and avoidance. Fluoxetine may help reduce the hyperarousal and avoidance symptoms commonly experienced by individuals with PTSD. By modulating serotonin levels, the medication can potentially decrease the heightened state of alertness and anxiety that often accompanies this condition. Impact on intrusive memories and flashbacks. Some studies suggest that fluoxetine may help alleviate the frequency and intensity of intrusive memories and flashbacks in PTSD patients. While more research is needed in this area, the medication's effects on memory processing and emotional regulation could contribute to its potential benefits in PTSD treatment. Combining fluoxetine with trauma-focused therapy for optimal results in PTSD treatment. Fluoxetine is often used in conjunction with trauma-focused psychotherapy. This integrated approach addresses both the neurobiological and psychological aspects of PTSD, potentially leading to more comprehensive and lasting improvement. Fluoxetine for anxiety in special populations. While fluoxetine has shown efficacy in treating anxiety disorders across various populations, special considerations are necessary when prescribing the medication to certain groups. Understanding these nuances is crucial for optimizing treatment outcomes and ensuring patient safety. Fluoxetine use in children and adolescents. Anxiety disorders can significantly impact children and adolescents, affecting their social development and academic performance. Fluoxetine has been studied in pediatric populations and has shown efficacy in treating various anxiety disorders in younger patients. However, careful monitoring is essential due to potential risks associated with SSRI use in this age group. Geriatric considerations. Older adults may experience anxiety disorders differently, and their response to medications can vary. When prescribing fluoxetine to geriatric patients, healthcare providers consider factors such as potential drug interactions, altered metabolism, and the increased risk of side effects. Dose adjustments and close monitoring are often necessary to ensure safe and effective treatment. Pregnancy and breastfeeding. Managing anxiety during pregnancy and postpartum periods presents unique challenges. While fluoxetine use during pregnancy carries potential risks, in some cases, the benefits may outweigh these risks. Healthcare providers carefully weigh the potential impacts on both the mother and the developing fetus when considering fluoxetine treatment during pregnancy or breastfeeding. Side effects and safety considerations. As with any medication, fluoxetine can cause side effects, and its use requires careful consideration of potential risks and benefits. Understanding these aspects is crucial for patients and healthcare providers alike. Common side effects. Some individuals may experience side effects such as nausea, headache, insomnia, or changes in appetite when taking fluoxetine. These effects are often mild and tend to subside as the body adjusts to the medication. However, persistent or severe side effects should be reported to a healthcare provider promptly. Sexual side effects. Sexual dysfunction is a potential side effect of SSRIs, including fluoxetine. This can manifest as decreased libido, difficulty achieving orgasm, or erectile dysfunction. Open communication between patients and healthcare providers is essential for addressing these issues and exploring potential solutions. Risk of increased anxiety or agitation. Paradoxically, some individuals may experience increased anxiety or agitation when starting fluoxetine treatment. This effect is usually temporary and often resolves as treatment continues. However, patients should be aware of this possibility and report any significant worsening of symptoms to their healthcare provider. Discontinuation syndrome. Abruptly stopping fluoxetine can lead to discontinuation syndrome, characterized by symptoms such as dizziness, nausea, and mood swings. To minimize this risk, healthcare providers typically recommend gradually tapering the medication under medical supervision when discontinuation is necessary. Optimizing fluoxetine treatment for anxiety. Maximizing the benefits of fluoxetine treatment for anxiety disorders involves more than just taking the prescribed dose. Several strategies can enhance treatment efficacy and improve overall outcomes for patients. Individualized dosing and titration. Finding the optimal dose of fluoxetine can be a process of careful titration. Healthcare providers typically start with a low dose and gradually increase it based on the patient's response and tolerance. This individualized approach helps maximize benefits while minimizing side effects. Combining fluoxetine with psychotherapy. While fluoxetine can be effective on its own, combining it with psychotherapy often leads to superior outcomes in anxiety treatment. Cognitive behavioral therapy, CBT, in particular, complements the medication's effects by addressing thought patterns and behaviors contributing to anxiety. Lifestyle modifications. Incorporating healthy lifestyle habits can enhance the effectiveness of fluoxetine treatment. Regular exercise, adequate sleep, stress management techniques, and a balanced diet can all contribute to improved anxiety management and overall well-being. Patient education and engagement. Educating patients about fluoxetine's mechanism of action, potential side effects, and the importance of treatment adherence is crucial for successful outcomes. Engaged and informed patients are more likely to stick with their treatment plan and communicate effectively with their healthcare providers. Future directions in fluoxetine research for anxiety. As our understanding of anxiety disorders and the mechanisms of action of fluoxetine continues to evolve, several exciting areas of research are emerging. These investigations hold promise for further optimizing the use of fluoxetine in anxiety treatment. Personalized medicine approaches. Advances in genetic and neuroimaging research may lead to more personalized approaches to fluoxetine treatment. Identifying biomarkers that predict treatment response could help healthcare providers tailor medication choices and dosing strategies to individual patients, potentially improving outcomes and reducing side effects. Novel formulations and delivery methods. Research into new formulations of fluoxetine, such as extended-release versions or alternative delivery methods, may offer advantages in terms of dosing convenience or side effect profiles. These innovations could potentially improve treatment adherence and patient satisfaction. Combination therapies. Investigating the potential synergistic effects of combining fluoxetine with other medications or novel therapeutic approaches may lead to more effective treatment strategies for anxiety disorders. This research could open up new possibilities for patients who don't respond adequately to current treatment options. Long-term effects and neuroprotection. Ongoing studies are exploring the long-term effects of fluoxetine use, including its potential neuroprotective properties. Understanding how the medication affects brain structure and function over extended periods could inform treatment guidelines and shed light on its role in preventing anxiety disorder recurrence. In conclusion, fluoxetine represents a valuable tool in the treatment of various anxiety disorders. Its ability to modulate serotonin levels and promote neuroplasticity offers hope to many individuals struggling with anxiety. As research continues to uncover new insights into fluoxetine's mechanisms and applications, we can look forward to increasingly refined and effective treatment strategies for anxiety disorders. By combining medication with psychotherapy, lifestyle modifications, and personalized approaches, healthcare providers can help patients unlock the full potential of fluoxetine in their journey towards anxiety relief and improved quality of life.